This video on human factors in the design of the lab coat is a continuation of the term paper document. In the term paper conclusion, we deducted that the main reason the firm's design concept did not contend successfully with the winner of the J-Labs Quickfire Lab Coat Challenge was because we didn't have a tested prototype. If the firm was able to take their efforts a step further, using human factors and engineering to design an experiment or experiments, create a viable prototype, then test the usability of the prototype design, the design recommendations demonstrated in the lab coat garment prototype would have the proof of concept and the credibility inherent in the winner of the J-Labs Quickfire Lab Coat Challenge. In this video, we will discuss additional human factors in engineering that would be relevant to these said corrective steps and experiments for the proposed lab coat prototype. In the task analysis in the day of the life of physician, we look at the physician's day-to-day activities as well as the work team to which the physician interacts with. And so the physician or physicians, there may be more than one doctor in one office or more than one physician in one office, or if it's a specialist, it might be more than one specialist in one office. And that with them at the center, that office may have a office manager that handles facilities, vendors and suppliers. Um, uh, There'll be a legal team, an accounting team for billing and any HIPAA related situations. These doctors may also reside in hospitals and clinics, connecting with specialists there, pharmacy for their prescriptions, and then they'll have a staff of nurses, assistants, and receptionists. These nurses, assistants, receptionists, and staff will be in direct contact with the patients, with their outpatient care or inpatient care. And so, in the day of the life of physician, specifically, it may vary. His tasks from a day-to-day basis may vary depending on the demand for the day. So in the day of the life of physician, this is the work team. His day will vary from day to day, but we know there are some standard activities from one physician to another physician. They will see patients. They will interact with the staff. They will carry out procedures and prescribe medicine. And so there are some standard activities that we know that the physician will be doing in the lab coat. Within the term paper and the digital body wireframe, we showed how the lab coat would lay over the body wireframe and the motions that would be typical of a physician in the workplace, body movements and body motion that are typical for a physician. We analyzed that in the digital wireframe and the overlay of the lab coat. And we can show that diagram again here. And so if we are to design an experiment, it would include a participant design. And so we are outlining some of the things that we would take in consideration in qualifying our participants. User type options, we have physicians, doctors, science professionals, or medical professionals. And so this particular experiment would be only for physicians, those that were licensed to perform medical procedures or to prescribe medicine. The context or environment would be a private office. The age range of a young physician, according to the young physician section, is less than 40. And then we'll have a sample size group for greater than 40. Our sample size, we are going to keep that at 15 physicians who are required to wear a lab coat. With that participant design, we'll go on to these potential experiments to test out our lab coat design prototype. The null hypothesis, we have four here. Null hypothesis one will be new lab coat design reduces physician workload or work overload, stress, and efficacy, as well as physician workflow. And then null hypothesis two will be new lab coat design increases patient safety and patient experience. Null hypothesis four is to prove the new lab coat is preferred over the traditional lab coat, or which options on the new lab coat are most preferable, and then those usability tests. And so we're trying to find out whether the claims that we're making on our new lab coat design prototype are true. So these are the experiments that we will explore in this particular discussion. The data collection required to prove that particular feature to be true would be to collect data on work overload, stress levels, and efficacy of the physician wearing a traditional lab coat and then wearing the new lab coat design. We can use performance-based measures for mental workload, asking them to do primary tasks while simultaneously doing secondary tasks, whether they're procedural or workflow tasks. We can calculate based upon the time required to do some of their daily tasks and the time allowed, the resources required to do some of the um, things that are required of a physician and the resources allowed. We can measure the physical workload by measuring heart rate, brain activity, respiration, um, sin, the skin-based measures, metabolism, and even calculate their rest cycles. We could also take surveys, interviews, and conduct natural observations on the physician's day-to-day activities. And so this to try to prove, to say that, okay, this lab coat reduces work overload, stress levels, and efficacy of the physician. In addition to increasing workflow, we have to have scientific proof of that. And so these experiments will help us to prove that within the lab coat design. And so the second um, item that we're trying to prove, whether it's true or false, is that the new lab coat increases patient safety, patient experience. And so this one is going to be a little bit harder to collect without special written permissions because it deals with patient privacy. We can chart patient experience with the physician workflow, whether it's online, virtual, or in the office, the use of the process map, where they're satisfied with their service. We can do that with surveys and interviews, also in natural observation, getting permission. We can chart patient procedures with the physician workload. Natural observation is very important because we don't want response bias or the Hawthorne effect, where because folks know that they're being watched or for some other reason, they uh, act in ways they wouldn't normally, or they answer questions is not honest. The fourth claim that our new lab coat wants to make is that it's preferred over the traditional lab coat. Which options on the new lab coat are most preferable, and then for it to pass some usability tests. And so of the claims to which we're designing experiments, this one might be the most easiest one to prove true or false. So let's take a look at how we have designed the participants for this particular experiment. Our independent variable are those physicians who wear a lab coat. Some physicians do not wear a white lab coat. Some of them wear regular clothes. Some of them wear scrubs. But then this participant design, these physicians are going to be those who wear a white lab coat or a lab coat. The two levels of conditions that we're going to compare is the traditional lab coat against the redesigned lab coat. And then the participant groups, we said we're going to do a sample of 15 physicians. S1 will be those that are less than 40. S2 will be those that are greater than 40. Each one of the groups will experience both conditions, meaning they're going to wear the traditional lab coat for 60 days. We'll collect the data, and then they'll wear the redesigned lab coat for 60 days, and we'll collect the data. We'll compare the data within the group and between the groups. Okay, so it's a mixed design. We have charted some factors that we will be asking our physicians to rate on a scale of 0 to 6. That scale would be 0 disagree strongly, and 6 strongly agree. So I have 3 categories: lab coat usability, the user group, and then system functionality. And under lab coat usability, we'll be measuring whether or not the physicians used all the features, whether or not the lab coat was easy to use. Under user group, we want to know whether it was easy to learn how to use the wearable technology. Was it comfortable? Then under system functionality, did the lab coat increase safety? Did it improve workflow? And so S1 will be asking those physicians who are under 40 to rate those factors for each one of the lab coats. And then we would ask the participants over 40, those physicians over 40, to rate each lab coat based on these factors. So after collecting our data from the usability test, we'll determine if for claim number 4, if we have enough data to make those claims, whether they are true or are seen as false. So these are the 4 experiments that we would conduct. And so if we're able to say, yes, that is true, as a result of these experiments, then we will have us a viable prototype that can contend with other competitors in the space. Thank you.